Good afternoon. So I would like to welcome you to the second round of ACRAS. Actually, the view from here is a little bit different, and it's so powerful and impressive to see all the consumer market leaders are around one table discussing same points, having same point of view. So it's very interesting for me. And I would like to thank you for all the audience and for all the participants for attendance. And God bless you all. يعطيكم ألف عافية. And of course, God bless UAE because it's always the meeting point for all countries. So I would like to start by introducing myself. My name is Sali Daoud. I'm Regulatory Affairs Specialist at LVMH, Louis Vuitton Group, Middle East, Beauty and Cosmetics. And I will serving you today as a moderator. For afternoon session, we roughly will talk about the Cosmeceuticals Regulation in two major countries in GCC, which are Oman and Kuwait. So we can start by moving along with our session with Dr. Amani Al-Siyabi. She is the head of Herbal Medicine and Health Products Drug Control Department in Oman Ministry of Health, who will be speaking to us today about regulatory requirements for medicated cosmetics in Oman. So welcome, Dr. Amani. So, Dr. Amani, the floor is yours, and good luck.
Hello, everyone. Thank you for the introduction, and thank you for giving us this opportunity to share our knowledge and experience with you. So here we are, medicated cosmetic products. So I think cosmetics are well defined today in the morning sessions and in the last previous presentation. So I just want to highlight the definition of cosmetic products just to make sure the differences between cosmetics and medicated ones. And it's not regulated till now under Ministry of Health. Right now it is regulated under Ministry of Commerce and Industry. Just keep in your mind that cosmetics must comply with the GSO standards in Oman. Okay. Moving to medicated cosmetic products. These are subcategory under health products. Okay. These can be defined as topical preparation intended to treat or prevent diseases or otherwise contain active ingredients known to affect the structure or functions of the human body. Any products claiming for some certain medical conditions, for example, acne, diaper rash, or melasma, cuts, insect bites, or will be classified under medicated cosmetic products. Or any products containing more than the specified concentration of one or more of the ingredients mentioned in the classification guidelines, and it will be available in the website. For example, zinc oxide more than 25% will be classified as medicated cosmetic products, and there are so many ingredients. For example, alpha hydroxyl acid, more than 10% will be classified as medicated cosmetic products. Acceptable dosage form include but are not limited to mouthwash, creams, ointment, balms, gels, and lotions. So is the product medicated cosmetic or normal cosmetic? Now, there are many questions regarding this borderline area. As you can see that the normal shampoo is classified as cosmetic. However, anti-dandruff shampoo will be classified as medicated cosmetic. Usually, all products can be easily classified into pharmaceutical, herbal, health, or medical device based on the composition, medical claims, or presentation of the product or classification in the country of origin. So according to the classification, the agent will be applying the required regulation to get the approval certificates. In case if you have any questions or any assistance regarding the classification, the service is available online on our website. Okay. Here you can scan the barcode for the guidelines classification. So for Both products, the cosmetic products and medicated ones, will share some characteristics in such that they cannot be taken orally. For example, collagen drinks cannot be classified under either both of them. Products cannot be administered through eyes or nasal or ears, cannot be intended for injection, and cannot be administered through the anal or vaginal, for example, suppositories. Even if the purpose is cosmetic, it cannot be classified under these products. However, the main differences between the cosmetics and the medicated ones will lie in the following aspects: the composition and the claims made about the products. Here I'll go for some examples just to show the differences between the cosmetics and the medicated ones. So for example, the first one, sunscreen products. These are defined as used usually for protection from UV radiation through scattering or reflecting. However, medical claims such as reduction of skin cancer or solar keratosis will be classified as therapeutic medicated product. However, products for application to the lips or anti-wrinkle will be classified as cosmetic products. Products containing more than the specified concentration of one or more of the ingredients mentioned in the classification guidelines will be classified as medicated one. For example, we have two types. We have physical and we have chemical filters. And we have currently 32 active that work as UV filters. For example, zinc oxide, if it exceeds more than 25%, it will be classified as medicated product. Feminine intimate products are usually classified as cosmetics, especially it is placed in contact with the various external parts of the human body. However, some claims such as itching, irritation, redness, vaginal discharge, or extreme mucus dryness will make it as medicated one. And some products that contain ingredients, for example, povidone, iodine, or to control vaginal flora, like lactic acid, will make it as medicated one. Third, antiperspirant usually are defined as designed to control sweating and body odor. However, if it is used for medical purpose, it will be classified as medicated cosmetic products, as you can see, hyperhidrosis. Usually products containing ingredients, for example, aluminum salts, more than 15% will be classified as medicated product. Oral care products are intended to be applied on the teeth or mucous membrane of the oral cavity. However, there are some products that can be usually classified as cosmetic. Normal antiseptic mouthwashes will be classified as cosmetic products. But if it contains chlorhexidine or cetylpyridinium more than 0.7%, it will be classified as medicated product. Medical products used to treat mouth ulcers, sore gums, gingivitis, or dry mouth will be classified as medicated ones. For some antiseptic, as I mentioned previously, chlorhexidine, cetylpyridinium will be classified as cosmetic one. Phenol mouth spray that used to relieve pain, irritation, also classified as medicated one. Toothpaste containing fluoride more than 1,500 ppm. Lastly, hair care products, a product which is intended to be applied on the hair of head or face or except eyelashes. However, there are some medical claims that you can see in the products. These will make it as a medicated one. For example, to control, prevent, reduce, eliminate the occurrence of dandruff, related to symptoms related to itching, irritation, redness, flaking, scaling. This all will make it under medicated one. Any products intended to treat or prevent head lice will be classified as medicated one, irrespective of their composition, as long as it works as a physical or chemical. If it works as a physical manner, it will be classified as medical device, as for example, silicone or dimethicone. Regulation and circulars. So in 2005, we start registering the health products, okay, and where we set all the documents, the administrative documents and the analysis documents were set down to control, to make sure that all the products are important in Oman to make sure that it is safe and effective. And the fees around $800 for every product and $400 for every additional pack size. Registration process is, registration certificates usually takes 5 years, valid for 5 years, and every 5 years you need to go for the same process. In 2008, we made the format for the post variation. So all the variation, including shelf life, storage condition, pack insert, all these, etc. However, changes in manufacturing site or the active ingredients will make it as a new product. Okay. In 2021, to speed up the registration, we made a new second version of the application form, so to make it easy for the applicants to follow our steps, our registration. And for the re-registration, in 2021, we stopped analyzing the product for re-registered products. In 2022, we implement a new application form for medicated cosmetic products, but just to highlight that it's the same under health products, but we make it as a separate application form, just to make it easier for the companies to follow, and so less documents are required. And here I'll explain later. This is the barcode for if you would like to scan for the medicated cosmetic products application form. And if you have any comments, you are welcome for your feedback. Here, this is the application form. Usually, we will ask for the local agent has to be assigned in Oman, and then we will ask for the drugstore to be to submit the application form. Along with the application form, he has to submit drugstore issued by Ministry of Health and a relationship letter between the agent and the manufacturer, and the commercial registration certificate issued by Ministry of Commerce. And for the manufacturer, we will ask for GMP or ISO certificate can be accepted. And if the marketer authorization holder is different, then we will ask for another relationship letter between the manufacturer and the marketer. For the product, we will ask for CPP or free sale certificate, declaration letter saying that the product is free from hormones, steroids, pork derivative, and etc. And another declaration letter saying that the colorants, diluents, and preservative are allowed, permitted according to international health authorities. And 2 samples and artworks, leaflets. For the analysis part, now we make it easy for all the companies. We can accept the certificate of analysis to be done in external lab, authorized in Oman. Okay, and according to some certain parameters, which is included in the application form. Okay, along with the certificate analysis, we will ask for some certain documents, composition formula, specification, packaging material, specification, certificate of analysis. And finally, for the clearance, certificate of analysis and invoices are required. Just during clearance, we need to make sure that the specification is exactly the same that we have approved. If they identify that there are any differences, then it might be stopped. The clearance might be stopped. The whole process might take 60 days, so less than before. Usually it takes 1 year. For medicated cosmetic, it will take only 60 days. So here, how do we receive the appointments? Usually we receive the appointment first in, first out. So after we receive the file, we will check if all the documents are submitted, valid and original. And if accepted, then it will be evaluated by the concerned person. We will evaluate it in terms of safety, quality, and efficiency. After the product is completed, we will present the file to the TCR, Technical Committee of Registering Herbal and Health Products. And this technical committee is conducted every month, almost. So after the product is presented and satisfied, we will issue the certificates, which is again valid for 5 years. Thank you. If you have any questions.
Thank you. Thank you so much, Dr. Amani, for this strong presentation and the points that you made. And as you might know, that our part of Cosmeceutical Regulation consists of 2 parts. First part that we attend for Oman regulation, and the upcoming part will be for Kuwait regulations. And it will take around 20 minutes. And after that, we have panel discussion, open discussion to receive your questions and inquiries for around 10 minutes. So now moving to the second part of our session. So please welcome Dr. Yusra Al Ajmi, Head of Material and Cosmetic Department at Ministry of Health Kuwait, and also Dr. Binu John, Senior Pharmacist, Drug and Food Control Department at Ministry of Health in Kuwait. But unfortunately, they will attend with us virtually, and hopefully next year they will be with us here physically, and we will welcome them in Dubai. So Dr. Yusra and Dr. Binu, hi, good afternoon.
Good afternoon to you. You hearing us?
We are hearing you, yes.
Okay.
So
Great.
now the floor is your doctors, and you can feel free to start.
Yes, I am hearing you. Could you hear us?
Yes.
We want to share the screen with you.
Can you fix the camera more if possible? And you can start. Yes. We are hearing you.
Okay, we are preparing our presentation. You can see us in the screen?
Yes, presentation is available.
Okay, good afternoon, everybody. Sorry for making this virtually, but for reasons that we cannot attend a meeting.
Hopefully next year, doctors, you will be with us here.
Inshallah. Inshallah, next year we will be physically being there with you.
We are appreciating your time, doctor.
Thank you, dear. Today, our presentation, we're going to talk about the cosmetics and the cosmeceutical regulation here in Kuwait. At the beginning, we're going to define the cosmetics and the cosmeceutical. Let's start with a definition of cosmetics. Cosmetics product are materials that apply to the human external body parts or teeth or hair for cleaning them, perfuming them, changing their appearance, protecting them, keeping them in a good condition, or correcting the body odors without having any effect on function of body organs or as treatment. This is the definition of cosmetics. Let's go for the definition of cosmeceutical. So in between that, we're going to explain also the difference between them. The definition of cosmeceutical are a product that acts as a both cosmetics and medicine and combine cosmetics product with the pharmaceutical products. Cosmeceutical are a cosmetics product with the bioactive ingredient to have a medical benefit, typically applied by wrapping the product on the skin, containing high amount of active ingredient like vitamin C, hyaluronic acid, used for a varieties of purposes to remove the wrinkles, decrease signs of aging, heal the scars, prevent acne, etc. Now the difference between the cosmetics and the cosmeceutical. The most notable difference compared to conventional cosmetics is the amount and concentration of active ingredient, which is much higher in the case of cosmeceutical. Some of the most common active principles in cosmeceutical are hyaluronic acid, plant extracts, amino acids, and peptides, depigmenting active ingredient, vitamins and antioxidants, hydroxy acids, growth factors, or cell renewals. All these are a very common active principles in cosmeceutical. This fact allows them to penetrate deeper into the dermis layer of the skin, which translates into a more visible results in the long term. We can therefore affirm that the effectiveness of cosmeceutical is higher than cosmetics grade, of course, skincare product, but without reaching the invasive level of pharmaceutical product. This is the difference between cosmetic and cosmeceutical. Now we're gonna define between a cosmeceutical and pharmaceutical. Pharmaceutical are agents intended to alter and change or protect the skin from abnormal or pathologic condition. Cosmeceutical graded products are generally something you can buy over the counter, also due to the accessibility. These products are designed to be safe so that anyone without a specific training or skin knowledge can buy and use it on a daily basis without the risk of causing a skin damage. Okay, now the difference. Cosmeceutical the ingredients can proceed as 70% pure skin layer, it works out layer, where to buy over the counter professional. The pharmaceutical ingredients can be proceed 99% pure. It will be skin layer. It works deeper layer where to buy licensed skin. Dr. Binu, she can complete this one now on
Yes. And the pharmaceutical and the cosmeceuticals, the difference, we have put it in a graphical form. That one in pharmaceutical and cosmeceutical, there are common things also coming. It's created and regulated by professionals. It can be used to treat skin conditions. Can be recommended by professionals. Contains active ingredients, but the availability and the penetration of the skin is that differs in the cosmeceutical and pharmaceuticals. Regulations for registration of cosmetics and cosmeceuticals in Kuwait. The regulations in Kuwait is known as MT 200/97. This includes the procedures for manufacture, import of cosmetic preparations that have medical features. That is cosmeceuticals. We classify these products as face care, body care, hair care, and oral care. The face care, makeup and makeup removing products for face, nail, body, etc., face mask, face scrub, exfoliating products, skin whitening, anti-wrinkle products. Under the body care, it can be both bath and shower preparations, including toilet soaps, shaving soaps, refreshing and moisturizing wipes, external intimate hygiene products, creams, emulsions, lotions, gels, and oils for the skin, depilators, sunscreen, sun tanning, after sun products, anti-cellulite products, firming lifting products. And hair cleansing products, conditioning products, no-rinse hair caps, gloves, and gloves, hair dressing products, hair oils, hair growth products, hair setting and fixing, waving, and straightening products, hair tints and bleachers. And under oral care, all type of tooth cleaning and all of refreshing products. And also, we are registering perfumes, EDT, colognes, deodorants, antiperspirants, and normal makeup removing products also. For the registration of imported products in Kuwait, we have the importers should fulfill certain documents. We are asking them to submit duly legalized research certificate, copy of manufacturing license, legalized GMB certificate, certificate of composition, legalized BSc certificate, safety certificate, list of countries that products are registered, efficacy studies of the cosmeceutical products. In addition to above, the following documents are required: valid import license holding agency in Kuwait, valid registration license from the Inspection Administration, copy of the signatory of the Kuwaiti sponsor, copy of signature authority obtained from the Kuwait Chamber of Commerce and Industry. In normal cases, the freezer certificate can be obtained from the health authorities, concerned governmental authorities for the cosmetics in the country of origin, of the licensed holder. But there are following exceptions are there. If manufacturer is a contract manufacturer in a different country than the license holder, and if the product is only marketed in the license holder's country, a free sale certificate can be from any other authorities followed by Kuwait Embassy with explanation for the reason. But if the products are not marketed in the license holder but marketed in the contract manufacturer's country, by the permission of the license holder, a free sale certificate can be issued from the manufacturer's country with the proper explanations. Now going to the registration for the products manufactured locally. For that, the following requirements are needed. Documents are needed. Copy of manufacturing certificate issued from the Kuwait Public Authority for Industry. Copy of GMB certificate from the Food and Drug Administration, that is from here. Certificate of composition along with the exact percentage and purpose of each of the ingredient. Laboratory certificate proving the products are free from harmful microbes. Analysis certificate mentioning color, smell, appearance, homogeneity, touch, acidity level, amount of alcohol if used in percentage of and if any heavy metals. Proof of scientific efficacies of preparation, those are of cosmeceuticals. Efficacy studies of BSc certificate from the country of origin of the raw material supplier if the products contain any biological origin ingredients from animal. Kuwait regulation also allows to register and sell the customized products or products made outside the country for the local brands. Registration procedures are same except for the appointment letter showing the relationship between the manufacturer, and the owner of the product for the products that is making outside. But if the bulk quantity is importing, require a repacking license also. Now going to the issues that we are facing during the borderline products.
Okay. I'll complete with you, my colleague. The issue is facing registration for the borderline products. The borderlines, that means the product can be between cosmetics and non-cosmetics. Let's start with the definition of these. The products that may be hard to distinguish between medicine and cosmetics. It may be unclear whether a particular product cosmetics under cosmetics regulation or other section regulations such as a product are called a borderline products. Decision about the classification of the products are done by case. And we have in our Food and Drug Administration here in Kuwait, we have like a committee take a decision, either these products gonna be under a cosmetics regulation or under a health product, which is sometimes it could be pharmaceutical or a non-cosmetics. Here we have a classification committee with the selected members from each section to study case by case and classify the products. And this classification, it's according to the claims and indication, ingredients, and a method of application, and degree of penetration, physiological function. Okay, let's take them one by one. It is about the claims and indication. For example, the product that contains a substance stimulating a hair growth or reducing hair loss, we are looking for the claims promoting hair growth usually relates to the pharmaceutical products, such as, for instance, those containing minoxidil, a substance that it is prohibited as a cosmetics ingredient, of course, while the claim reducing hair loss usually relates to the cosmetics product. Therefore, depending on the active ingredient and the claim of the product, we register the product. Products for atopic skin. Atopy is a type of hypersensitivity. Atopy and atopic dermatitis are used as a synonym in relation to cosmetics product. WHO classified several diseases due to atopy: acute atopic conjunctivitis, allergic asthma, atopic dermatitis, and neurodermatitis. Such as products are assessed on a case-by-case basis. Product presented as appropriate for suitable to skin with atopic tendency. Atopic skin can be qualified as a cosmetics product. But if product presented as having properties to treat or prevent atopy or atopic skin cannot be qualified as a cosmetic product. Regarding the ingredients, product containing peptides, over a period of decades, many new peptides are incorporated in the cosmetics products, depending on the topical action of the peptides. There are mainly type of peptides: signal peptides for the collagen production or for increasing the engine phase, for feel-good skin defense, for inflammatory tripeptide, neurotransmitting inhibitor peptides for the muscle relaxation, wrinkle relaxation. For example, the acetyl hexapeptide. There is the enzyme inhibitor peptides. It's for dark circles, buffins, and brightening, lightening product. Soya bean peptides or rice peptides. Okay, this is for example also. A carrier peptides for enhancing the delivery like copper peptide. All the above mentioned peptides and neurotransmitter peptides are not registered as a cosmetics, and other products registering as a cosmetic depending on the direction and indication of the products. About the method of application and degree of penetration, products that using by professional by some invasive technique like lontophoresis, mesoroller needle are not considering as cosmetics. Physiological function, like a product that plump lips. Products that make lips more volumized may in principle fulfill the definitions of cosmetics product because they are intended to be placed in contact with the lips with the view to the exclusively or mainly changing their appearance. These products may also meet the definition of medicine or medicinal product by virtue of function, whereby the product is used to administrate with the view to restoring, correcting, or modifying physiological function by exerting pharmacological and immunological or metabolic action, that it is restoring, correcting, or modifying physiological function. If the product acts through inflammation and or irritation, the deliberate induction of a swelling effect could be perceived as a significant modification of one or more physiological function in lips, thus bringing the product under the definition of medicine product. The validity for the registration here in Kuwait, it's a 5 years. Usually when we register the cosmetics products, our certificate, the validity for it, it's a 5 years. And some products are after the registration has some variation could be happened. And this variation There is a minor variation and there is a major variation. The variation, it's any change happened in the product after the registration must be informed to the section, and they are categorized in the three different ways. There is a variation to be considered as a new cosmetics product. Can be happened if there is any change in the active ingredient, removal of any existing active ingredient, change in the quantity of active ingredient, dosage form. The major variation, this is a major variation, change in license holder or change in the name of license holder, transfer of agency, change in the intended use or claims, direction of use, change the shelf lives of the product, could be also change in the name of the trade name of the product. And there is a minor variation, which is a variation in a very slight things like a change in the label of the product, revised wording, color, font, picture, change in product container, change in additive, change in address of license holder, barcode. And of course, as you know, this registration has some fees, and our fees, it is a 10 KD for the new registration. For the renewal, we're taking a 250 per certificate, not per product, like a registration for a new one. And there is a major variation. It costs 150 KD. And the transfer agency, it's a 500 KD of fees. We have references here. We use it in our section. It's a CIR, European Cosmetics Directive, and US FDA, COLIPA, GSO, of course. This is all our references that we are depending on them to get some information, get the resources. That's all. Really, it gives me a great time to be with you, even if it is virtually. But thank you so much for giving us the time to produce ourselves and to introduce our presentation. Thank you so much for all the people who are trying to make this meeting successful. Thank you so much for all of you.
Thank you so very much, Dr. Yusra and Dr. Binu, for addressing this interesting topic and being part of our event, even if we did it virtually. So now, ladies and gentlemen, it's the panel discussion part. You are all welcome to share your questions or your suggestions or your inquiries to our esteemed speakers, to Dr. Yusra, Dr. Binu, Dr. Amani, and all of them will answer you. And it will be appreciated if you can mention your name and affiliate before sharing your question. And I will excuse you to share my questions first, since I'm here. So I will take this opportunity. So Dr. Yusra and Dr. Binu, I have one inquiry or suggestion for Kuwait non-medicated cosmetics, if it is possible. Shall we see soon, like notification system, as we are doing in Saudi, or online registration like what we are doing in UAE for non-medicated cosmetics, makeup, perfume, these kind of products, instead of going a long process of registration, which take from 3 to 6 months? Can we take this opportunity, or might be if any project is ongoing related to this?
Yes, we are trying to make the online registration, but it's under process.
Oh, Sally, you have a very good information that we had taking this time for registration.
A little bit. I'm trying to. So, okay. So we appreciate if you can consider this inquiry from our side and study it. If it could happen, it will be great. And I have another question to you, Dr. Amani, if you allow me, regarding the testing of cosmetics product before importation and before clearance in Oman. Now, as most of us know, that we are doing lab test analysis for specific parameters per product category. Like for example, we will take face cream. But actually, it's under the same brand. Might be we have 40, 50 different names and different products of the same face cream. So what is happening now that we are testing all of them. So is there any flexibility to test only one product category per each subcategory to save time and cost? Because now if we have day cream named X and we have under the same brand, same manufacturer, another day cream called Y, we are testing everything. So there is any flexibility on this part? Yes.
Cosmetics.
Yes.
It's not covered by Ministry of Health.
Yes, it's by Ministry of
Commerce and Industry.
Commerce.
Yes.
So there is a link, or we can communicate.
No, I can't really help. It's not under my scope.
Okay, thank you, Dr. Amani,
Sorry
for
for
this
that.
part. And now all of you feel free if you have any question or any point you want to raise it out.
Hello, this is Tariq Hanoura, Regulatory Affairs Manager from Colgate-Palmolive. Actually, my first question to Dr. Amani. I would like to ask, what was the scope of reclassifying most of the categories as medicated cosmetics, although the same category might be classified in the rest of the GCC countries as cosmetics as per the definition or as per virtue?
In other countries?
Exactly, yes, yes.
Explain.
I cannot hear you, sorry, sorry, doctor.
Sorry.
It's okay.
As I explained before, that the product's classification is made on four major categories, major factors for the composition, claims made about the product, presentation. So usually this is what we go for, the classification. And accordingly, we define whether this is cosmetic or health products, which medicated cosmetic products.
Yani this is although that we have like a common regulation should be adopted across the GCC, which is GSO 1943 and the GSO 2528.
Now we are working on, sorry,
It's okay.
as I explained before, that the product's classification is made on four major categories, major factors for the composition, claims made about the product, presentation. So usually this is what we go for, the classification. And accordingly, we define whether this is cosmetic or health products, which medicated cosmetic products.
Yani this is although that we have like a common regulation should be adopted across the GCC, which is GSO 1943 and the GSO 2528.
Now we are working on GCC classification. So hopefully very soon it will be published and we will share the same classification and the same definitions among all GCC countries. We're sharing the same classification guidelines.
You mean to urge the rest of GCC countries to adopt the same?
Yes, for GCC countries.
For GCC countries to adopt the same classification
Yes,
model
yes.
that you are developing.
Yes, and it will be published online through Ta'awan.
But is it certain or sure that the rest of the GCC countries
Yes,
will?
it is published actually, and we start receiving application through Ta'awan. Yes, and you can get classification through GCC, but I don't know if all countries will comply with all GCC, with the common GCC guidelines. I mean, each country has their own local regulation. But at the same time, we are working now on the same criteria. We try to make it unified among all countries. But again, as I said, there are some countries who still restricted to their local regulations.
Okay, Doctor, thank
But
you.
sooner or later, we will be on the same track. at least for the, because to avoid the VAT problems and maybe.
So as I got from you, doctor, now we have ta'awun system that if we have a product in gray area or not yet 100%, we are sure that it will be cosmetics or medicated cosmetic, we can submit the document through this application or from to this website, and it will be official classification. But more or less, it's a GCC classification.
Okay. Thank you so much, doctor.
But again, each country has their own local regulation. So if they don't follow the same, still maybe they're working on that regulation.
Thank you, Dr. Amani, for this presentation. I have one question. We already have product which is health product. It's already registered in Oman. Due to manufacturing load and the capacity, they want to add a manufacturing site as a batch releaser as well for this product. Is this allowed in Oman?
They want to add batch releaser.
Yes. It's same MH, but we have already registering one batch releaser manufacturer active, but we want to add another batch releaser. Can we do that? This applicable in Oman?
Unfortunately, it's not allowed. No. Only one site is acceptable.
Okay, thank you.
Okay, good. So thank you, Dr. Yusra, Dr. Binu, Dr. Amani, for your attendance, and for all attendees and participants, thank you so much for your discussion and for your attendance as well. So finally, we come to the end of our Cosmeceutical Regulation section, and we would like to thank you all, and hopefully next year in the round number 3, we will meet here again. Thank you. Have a good day.